The following podcast is recorded and produced by Emerge, a media creators co-op, in affiliation with the network at bicbp-radio.com.
Hello, and welcome to Conversations with CASE. My name is Christine O'Hara, and I am your host today. I am very honored that I presently serve as the president of CASE, which stands for the Coalition of Agencies Servicing the Elderly. I also serve as the executive director of HEART, Inc., which is Home Assistance Referral Team. Today, though, we're going to focus on one of our members of CASE, and I am very excited to introduce you to Jim O'Brien from Nascentia Health. He is the Regional Outreach Coordinator and also a licensed New York State health insurance agent. So welcome, Jim.
Thank you. Thank you for having me.
Absolutely. That was a lot to say. Did I get everything out okay?
Everything was fine.
Oh, I'm so glad. I'm so glad. So, Jim, just tell us a little bit about yourself and what you do, what Nascentia is.
Yeah, so, before I get into Nascentia, my name's Jim O'Brien. I grew up in the area, town of Niagara resident. I grew up in the town. Currently live in Erie County, but have wonderful memories of the town of Niagara. So, would like to start there, but really give kudos to CASE a little bit. When I started with Nascentia Health about 3 years ago, it was one of the first CASE meetings that I had gone to. We have so much communication that I need to get out, and there is no, to me, there's no better avenue than other agencies that are dealing with our seniors, geriatric people that live in our community, our neighbors, right? There's no better opportunity than like a CASE meeting. But most recently, last November, I think it was November or December's meeting, we had some changes in Medicaid that were coming up come April 1st of this past year, 2025. But during my little presentation that I did at the CASE meeting, so many people reached out to me after I gave that, here's what's going on. It was really going to affect thousands of people in the area, and they knew nothing about it. So me getting that communication out was so key. I was able to kind of set up some meetings afterwards. I want to say 4 or 5 different meetings with different agencies that deal with these our people, and it was wonderful to get out. So if you live in Niagara County and to me want to reach like our senior population, please come to CASE, because I'm telling you, we are all looking for resources to help our community members that happen to be seniors. So.
Absolutely. You jumped ahead of my little schedule here, but that's great. And I think, I've certainly spoken with a lot of people on Conversations with CASE, and everyone comes back to the same thing. I mean, CASE is just a place. It's hard to believe unless you become a member of CASE. And to do that, as we know, it's $20 a year. You meet 10 times a year. Every month at a different location, and it's just a great opportunity to be able to network. And sometimes you go out and speak to people about what it is you offer, but they may not have a clue. We all kind of know what's going on, and so it's a little bit easier. I know this past meeting that we had just a couple weeks ago, Medicare is the big thing now. So there were several people who work in the Medicare field that were there for that same reason, as you said, to make sure that people understood it better. So appreciate that plug for CASE, and talk a little bit more about that. But why don't you tell us a little bit about Nascentia Health, what it is you do there?
What we do, the majority of my time is Medicaid managed long-term care. So that, in a nutshell, it's kind of referred to out in the field as MLTC. That is for those eligible that are on Medicaid to get long-term care services in their home. And we provide those services through Medicaid, different services. Very similar to, there's other agencies that provide those same services. HEART program, which are affiliated, really the same, different, but yet the same.
Home
I
care,
think,
yes, but
yeah,
we're a private pay, but yes, home care.
So as far as billing goes,
Yeah.
you know what I mean? I think there would be the difference. But again, the passion that I think Hart brings, knowing some of your team members, knowing the referrals that I've shared back and forth with Hart alone, right? Like I think, and I know if somebody can fit your program, that's what I try to do, right? So they might not all be for what I do for Nascentia Health, but again, get them the services that I know are out there.
Right.
And listen, so that's really what I do in the community. I am going out doing this. I am talking about managed long-term care, telling people what the difference is. People, when I talk, it's an insurance company. It doesn't have to do with their regular health insurance.
Sure.
This is additional benefits that are provided through Medicaid, if you're eligible, that give you those services in your home. So, again, there's a bunch of different services that we provide. But really, Nascentia Health, we are based out of Syracuse, New York. We have been doing this for 130 years.
Wow.
I still hear every day, never heard of Nascentia Health. We kind of changed into a health plan around 2000, and then in 2014, we were asked by New York State. They were developing these MLTCs, long-term care insurance. They were developing these, and they said we needed an organization that can get to rural communities, right? We stepped up to the plate. We service 48 counties in New York State, and some of the hardest to get to we service. The Adirondack region would be the one. Is very hard. But even the counties that I service, Cattaraugus, Chautauqua, Allegheny, a couple hours from here, those are also very rural. And, our team does a great job kind of touching base with them. We have nurse care managers that if somebody is enrolled with us, we kind of coordinate their care. Just like maybe a care manager, I guess, would kind of coordinate their medications and their doctors and stuff, and really touching base with people on a regular basis. We have requirements that we're responsible to do, in-home visits and things like that. So we do a lot out there in the community.
So tell me though,
I'm just gonna put this in. The mic is shaking a little bit. It's not your fault. It's just kind of.
so tell me, how do you find people when you say you're out there doing outreach, but you're in people's homes? How do you reach out to people? How do you find people that need you?
So I guess that's a great question. Outreach to me has always been easy. So where people that I need to touch, I go right in their facility, right? So when you're talking Medicaid mainly, the people that kind of qualify for Medicaid, they're always not, they don't always own a home, right? So they're typically in senior housing facilities, independent living facilities. There's many in Niagara County. The majority of the service coordinators, they know what an MLTC is, okay? The service coordinator, or I should say, for our audience, like that might be the property manager, right?
Sure.
So there's, we call them service coordinators. There's a group out there. But the majority in Niagara County, the senior living facilities, that's where I go. I want to go where they live.
Sure.
And typically, typically I have a group of other organizations that we put together little health and wellness fairs. We will schedule different events throughout Niagara County and the other counties I serve, but Niagara being my home.
And
but-
we're here in Niagara, so we'll talk about Niagara County.
So we, basically we put together different events throughout the calendar month. We will schedule out, different fairs. We'll do bingo. We like to have fun, right? We want to bring fun to some of these events as we're talking about the different services that we provide. So I get a ton of joy in doing that, but that's really how I touch base. Obviously, the OFA's, Niagara County Office of the Aging, is wonderful. They know really a lot about MLTC, and they're handling a lot of phone calls. Obviously, with people in need, they might start with the OFAs or the Western New York Independent Living Centers. There's so many great resources. I try to get the people that I work closely with, other organizations, I try to get them to find the places to go to, because we want to get these services out, because I think it's a wonderful, I know we do wonderful work with Nascentia and try to look out for our seniors as they age.
Absolutely, and I think that's such a challenge. I know that I have felt it working in the realm. I do home care. My organization does home care, private pay. But, again, we go to these case meetings and there's, 30 to 40 on any given first Wednesday of the month. And with all the resources that there are, people still don't know where to find us. And, I said one of my goals is I sat in the chair of the president for CASE for 2 years is to really get the word out. And I don't, the podcasts certainly help, but I think there's just got to be other ways, because let's face it, you don't know about something until you need it. And then when you need it, it's tough to find. So I think it's great that you go into the senior living communities. So you primarily will do an event that they can then come to? You don't go into someone's individual apartment or home?
So I do it all. You know what I mean? Not to... I do it all. Like when there's an assessment need to be done, we have community health workers that work in the area. We have provider relations. If there's something that needs to be done, I do a lot of home work per se. I do assessments where a nurse, I'm not a registered nurse, but I will assist with that technology piece. I might be the rich who's kind of getting things set up for a video conference, whether like an assessment that we're required to do it during intervals throughout the year. So, a video assessment if we can't get there in person. So I am in people's homes, and excuse me, if there's a lot of times I might get a call from a care coordinator, one of our care managers. Hey Jim, somebody in Niagara Falls, we're struggling. We might not be able to get a hold of them. They will get me involved, and typically I'm just kind of setting that into my car, hitting that spot, and a lot of times it's just, their phone might have broke, they, listen, for various reasons, just that communication line's broken. I try to connect that again. So I do a lot of
you do all the pieces. Well, I think anybody who works in a nonprofit does everything. You're for profit, but in any of these organizations, typically if you go into an assisted living facility or a senior living facility and you're going to do an event or a presentation, what are your next steps? Do you actually sit down one-on-one with the prospective client? Do you get family members involved? How does that work?
So as far as so after an event, somebody might be interested in I basically, I'm not a referral taker per se. I will answer every question I can for them, but I'm going to let our enrollment team contact them. Our enrollment's better equipped to kind of go through initial questions to see if they qualify. First and foremost is Medicaid eligible, right? So if we get through that hurdle, then there's some new requirements that just started September 1st. So and again, with everything with Medicaid, it just seems to kind of change year
All the
in,
time.
yeah,
It's
year
called
out.
insurance.
So September 1st, you now need to qualify. You need 2+ ADLs. So that's activities of daily
Daily living.
living. So you need to have more than 2+ ADLs, mobility being one of them. So that's a little bit out of what, like, I don't.
So you have to be able to be mobile. You need to be able to function a certain way.
Correct, but
Okay.
you need to have, really chronic illness is the key. So our enrollment team, they're going to get
They
them
do
to
it.
the next step.
I gotcha.
Right? They'll get them to the next step. And the next step, great question, is New York State assessment. So New York State comes in, we schedule that assessment, we help schedule that, get that scheduled. In New York State, this is obviously independent from us. They schedule this assessment because at the end of the day, they're eventually going to qualify and pay for those services. So New York State does an individual assessment to see if they qualify. And then, say, Nascentia Health, after they do get that qualifying letter, we will develop a care plan for them. Then we offer that to them. Typically, one of the biggest services we have is the home care, PCA services, right? That's what people need assistance in their home with type of home care. So we'll put a care plan together with trying to fill their needs, whether it be home meal replacements, things like that. If they need home meals delivered, we'll do that. The aid service, and then they can either accept or reject that because there are other options in the managed long-term care world.
Do you find that the average person, when you go in to, play bingo with a group of people, the average person really didn't know that they may qualify for this type of care, and they're like, a light bulb went off, and
Yeah, I think on occasion, yes. I think on occasion, for the most part, you know, you'll know if somebody needs what's the disheartening thing. What I tell my team to do when we're out there, and my team is other agencies, so it's other, so. What we try to do, the people that come down for our events, our bingo events, and our ice cream socials, we did a ton of ice cream socials throughout the area. When they come down, it's the people that don't want to come down that they can't come down because of a disability or for various reasons. So those are the ones that we try to get that message to the people that did come down, get
word
them
of mouth,
out there.
sure. So as far as your care aides and such, does Nascentia Health employ a pool of aides and what levels? And
We do. So our clinical team, we do clinical work in aid service in the central New York area. Here we're kind of contracting. In the Western New York area, we're kind of contracting through different agencies.
Gotcha.
Okay? We do our due diligence to vet and, things like that. And, listen, I would say it's a struggle. Niagara County's not a struggle too much. When you talk Allegheny, Cat, Chautauqua, those are the three rural. Those are our struggles. Those are, it is tough when you have a long drive, going out to the country per se, and and we can only spend 2 hours there. It's not really worth an aid to go. It's hard to fill in those gaps. But we do our best to take care of our members.
yeah, that's the tough thing. I will say, not that we're here to talk about heart, but we're very fortunate in the aides that we have, and I think it's just the setup that we have, because people pick their cases and they pick their hours and such. So we're able to have over 300 aides. What do you think makes Nascentia Health special? You said it before. There's a lot of agencies that do what you do, but what besides you, Jim? What makes it special?
I'd like to say our 600 employees, which I I haven't met them all, but I would say every time that I've had to touch base with somebody, let's say at our office, and again, to me, I want to deal with my 5 counties that I deal with. I do dabble a little bit in Monroe County as well too when needed, right? But the 5 counties, it's when I have a problem and need a question answered, I am telling above and beyond. We have people that will drive from Syracuse. It's happened numerous times, right, to help me with situations like for a specific issue that a member is having. So, like, to me, I think that's what sets us apart. And as of this year, there is another managed long-term care company going out of business per se. So it can't. It's not really out. It's not public knowledge again. So there's I think 5 of us that cover New York State. We will be Nascentia Health. We will be the only upstate plan. I say upstate. We're based out of Syracuse. We will be the only upstate plan. The others are all in the big city. So, so to me, that I take pride in that.
Absolutely.
And I think our people set us apart, and we are not perfect dealing in the Medicaid world. Never stops changing.
Sure.
We have been changing, but yet still growing steadily since 2014 with our managed long-term care. So
I would think you spend time in rehab centers or nursing homes too, if people they want to get them home
Yep.
to do.
Yeah.
I mean, there just seems like it's infinity where there can be people.
yeah, obviously as an insurance company, part of my job is discharge planners, right? When they're releasing, sending somebody off, and a lot of times, it's that whole Medicaid piece. So I think a lot of discharge planners know what we do. I try to visit them regularly. Sometimes I get shooed out.
We do
But
the same
listen,
thing.
it's part of what we
Yeah.
do, as long as they know and as long as that person is going to get care with any long-term care, whether it be my program or heart, or you know what I mean. There's
Sure.
other agencies out there, right? That's what the bottom
you
line
do.
is. So.
This might be a question that's difficult to answer, but what's a typical day like for you? Or is there no such thing?
Yeah, totally different. I love it. I just love it.
Do you spend like certain chunks of time in different parts of the state?
Yeah,
Or
so a little bit what I needed to get into was, my license piece. I probably spend about 80% of my time with the managed long-term care. Okay, that is our nonprofit piece. Just so you know, we are considered a non-for-profit. We do have a profit piece, right? So that is the other aspect. Very little time is spent there. Obviously, with October and open enrollment coming up, that will be my probably couple months that I spend. But I love switching gears. Like, so my normal day is how, typically I book my month. I am booked through mid-November at this point, but it's my doing. It's things that I can plan. It might be coffee with one of your teammates, which is on my schedule, right? So there's things like that I love doing, just kind of things like that, touching base wherever I can. So my
yeah.
day is not
it's never
typical.
the same. No, I guess I can say that too. I love that part of it,
Yeah.
that we can connect. What is one thing that you want people to know about you, about your services, about Nascentia Health? If you had something that you said for people to get help or that need it, what would you like them to know?
I think I'd like them to, as far as the passion that, I think I want our seniors to be able to be taken care of. Like, I run into too many situations where our seniors, to no fault of their own, are, whether it be no family, their health is failing. I have witnessed, like probably any of us have witnessed loved ones that pass. It's the circle of life, right? Like I would love them to know that if you need services, if we can keep your loved one in their home for as long as we can, we will do the best we can within the parameters of, Nascentia Health. And that would be what I'd want you to know. The passion that hopefully you hear in my voice is with a lot of Nascentia employees.
Sure. You hear that, in this type of business too. I probably say it on pretty much every podcast. You have to have passion to do
Yeah.
the work that we do. Whatever systems we work with, you have to have the passion. Jim, if someone wasn't in a senior community or in a house how could they hear about you? What if somebody's watching this and they live at home and they want to stay at home?
Yes.
What would they need
So,
to do?
I think the simplest thing, and I try to keep everything simple with send them to. I don't want to send you to a website. I don't want to send you. Listen, my phone number. That's how I roll. You can call me anytime. Is 716-343-4397. That is my cell phone. We do have a website, Nascentia Health. If you wanted to go, a lot of family members will listen. I want to check that out. So NascentiaHealth.org is our website. A lot of information on there. Again, what I'd love to say is we are a nonprofit. We strive to take care of, currently we probably have about 300 members. There's a couple thousand in Niagara County that, there's those people maybe with a handbag or physical therapist going into the home. And, you might see somebody with an Nascentia gear on,
now.
right? So, those are the ones that, they're taking care of people that are humans in that building, in that apartment, in that home. So, I guess that's what I'd like to know. And really, I cannot thank CASE enough for, I love the openness of our new president, which is you, like, just kind of getting what works. Like I've asked that question too, like, here's this podcast. How do we get it out? I don't know how we get it out. We got to try to continue to find different ways, because there are 30 agencies at every one of our meetings. And to me, I think you get what you put into going to a CASE meeting. I am looking to connect with people, not only at the meeting, it's after the meeting. So, and it's not, I just don't want to get Nascentia out to you. I want to know what Heart does and everyone else. So, because I think when I'm touching base with the community, I can refer them to your way, because I know you can help them. Right?
I certainly could not say that better, as far as the connectivity that we have at CASE and the freeness to be able to understand. And I say it also, I listen to everyone every month, but then when I talk one-on-one, I get so much more out of it. And I just have to say thank you for what you do. You could tell the passion in your voice. I mean, it's a beautiful thing. And I think, as I've said before, anybody who works in the realm of seniors, I think that's just a special trait that we have to have. So, Jim, is there anything else you'd like to add?
No, other than thank you. Thank you again, not to go back, but thank you for what you do, and for CASE, and finding time to do this stuff, and trying to come up with creative ways to get what we do out there. I am on your side, and I will help as well too. So
wonderful.
Thank you.
We have a new host of Conversations with CASE.
Thank you.
Thanks so much, Jim, and thank you all for tuning in to Conversations with CASE. This is Christine O'Hara saying goodbye for today. Thank you.